Bien. Good morning, everybody. Hello for a new experience. I am very happy to be with you in this Congress. All my best wishes for success. And we'll try this experience, have communication in English. And I will ask your indulgence because it's really a challenge for our national orators. They will communicate in English. And I want to remind you that there are 3 microphones front ahead and for the question. We will treat 3 thematics different. So we decide to finish each thematic. So we will have 25 minutes of communication and 5 minutes for question. All questions will be in English, please. And the response is in English too, of course. Alors, I will ask for the stage my friend Laraj, she will communicate around asthma. What is new in asthma? Dear Laraj, the floor is yours.
Dear colleagues and friends, first of all, I want to thank Dr. Mohammadi and APPRM for inviting me to discuss this huge subject about asthma and management challenges updated. And let's start. Bismillah. So, asthma between past and present. As we all know, asthma is the commonest chronic disease in childhood, especially in childhood, with approximately 12% of children asthmatic. It's a lifelong morbidity due to childhood onset. It can be controlled by medication and very well, actually, although not prevented. Asthma death still completely preventable, but morbidity and mortality remains high and is rising in some countries like ours. So we can see the age standardized mortality rates for general population ages between 5 and 34 years. We have different country, high-income country, low and middle-income country, and we see that we are less catastrophic than South Africa or Philippines. So, what is the factors leading to asthma death? Due to British guideline on the management of asthma, it could be due to inadequate treatment with inhaled corticosteroids or heavy and increasing use of beta agonists, or inadequate follow-up, or also inappropriate prescription of beta blockers or anti-inflammatory. So, what is overcoming barriers to effective management of asthma? It could be underdiagnosis or promote use of spirometry. It could be also access to asthma drugs, especially in low and middle income country like ours. It could be also lobby for more health resources for treating asthma or better use of current asthma treatments. And for that, we could avoidance of overuse of relievers like SABA, underuse of controllers and anti-inflammatory like corticosteroids, and understanding of patient preferences and behavior. So the big change in our management of asthma came in 2019 with this fundamental and huge change in asthma management with China. And short-acting bronchodilators are not longer recommended for adults and adolescents. Instead, they should receive symptom-driven in middle asthma especially, or a daily corticosteroids containing inhaler to reduce, first of all, risk of severe exacerbation and consultation in emergency. And this slide just show us that the preferred controller and reliever in track 1 is as needed dose of ICS formoterol, and we will see why this change came to life. So there are several studies that show that SABA alone increases airway responsiveness and eosinophilic airway inflammation, like the study that shows an increase in sputum eosinophils and PT20 methacholine at 6 weeks. And there is the famous Sabina study, England study, who show the association between SABA use and risk of severe exacerbations, primary care consultations, and hospital visits. So all this lead us to the SMART strategy, the maintenance and reliever therapy with ICS formoterol that could reduce severe exacerbations compared with ICS alone or ICS LABA plus SABA reliever with similar symptom control. And it's confirmed by regulatory studies and pragmatic open-label studies. So both budesonide and formoterol contribute to the reduction in severe exacerbations. So in practice, how could be prescribe low dose of ICS formoterol angina track 1? We have an example here for like step 1 and 2. Patient can take 1 inhalation whenever needed for symptoms. In step 3, he can take 1 or 2 inhalation from